As our food supply becomes increasingly globalized, the need to strengthen food safety systems is becoming more and more evident. According to the World Health Organization sources, unsafe food is linked to the deaths of an estimated 2 million people annually, including many children. To reduce incidence of food poisoning cases, we need to strengthen food safety control. Safe handling practices will reduce the chance of transferring harmful bacteria from raw food to cooked or ready-to-eat food. It is important to prevent cross-contamination because food like raw meat, shell eggs, and unwashed vegetables can harbor harmful bacteria.
Cohort focuses on the theme Safe Food Saves Life and aims to communicate the application of practical food safety knowledge among various stakeholders, especially the restaurant owners and the food service establishments. This documentary video is designed to enable stakeholders and partners to have access to different food safety practices.
Raw food materials should be purchased from reputed retailers who practice good standards of hygiene. Raw materials must be stored appropriately and used before the expiry or spoilage. It is also ideal to label it with date and item name. Food processing and preparation should be carried out in spacious and well-equipped areas. The walls of the kitchen and adjoining areas should be properly plastered and should be properly cleaned. Floor and ceiling of the food handling areas should be maintained in sound condition. The kitchen floor should be cleaned for debris and grease by sweeping and washing regularly. Solid waste from kitchen should be collected in closed containers and discarded on a daily basis in a hygienic and environment-friendly manner. The waste bins should have a lid to keep odors out and should be kept clean. The toilets and bathrooms should have self-closing doors. Entry of flies into the kitchen should be strictly prohibited by fitting insect-proof screens on the doors and windows or by using electronic fly traps. Ensure proper closed drainage systems and strictly avoid stagnation of water in the hotel and its premises. Ensure an adequate supply of potable water. The timely reports of chemical and microbiological quality of water from well-recognized laboratories should be maintained. All equipments and utensils should be cleaned regularly and kept dry to prevent fungal growth. Always use clean equipments and utensils for preparation and storing of food. Wash dishes with hot water and detergent and drain and dry before use. Ensure health of food handlers. They should possess health certificates from authorized medical officers at every 3 months interval. Food safety messages, signboards, and work instructions should be displayed in food handling areas wherever possible. Insecticides and disinfectants should not be kept in food handling or storing areas. All such hazardous and inedible substances and stored in a separate and secure containers. Fruits and vegetables should be thoroughly cleaned before using. Oil should be changed at regular intervals and discard if there is any color change. Ensure water used for drinking is adequately boiled. To correctly boil water, bring it to a rolling boil for at least 1 minute. Use different chopping boards for raw, cooked, and ready-to-eat food. Bacteria can reside in the crevices of chopping boards, so avoid boards made of soft porous materials and use smooth hard chopping boards made of hard maple or plastic and free of cracks and crevices. Avoid open area cooking, handling, and processing of food. The temperature of freezer should be maintained at -18 degrees Celsius or below. Food should be wrapped before storing in a freezer to avoid contamination. Raw food which is being defrosted should be stored on the tray or bowl that will catch any drip as the food is defrosting. Do not have too much of food items loaded in a refrigerator, as this will not allow the air to circulate properly and hinders the operation. Refrigerators should be cleaned regularly. Discard appliances and gadgets that cannot be used anymore. Periodically, wipe doorknobs, buttons in controls, light switches, and exhaust fans in the kitchen areas with cleaning agents. Even if they seem to be clean to the naked eye, they may already be harboring bacteria. Ensure that the kitchen has a fire extinguisher that is checked annually by the fire department or a fire inspection company. The staff should know how to use the fire extinguisher. Also ensure that the hotel has a first aid kit. There should be an adequate number of wash basins suitably located and used only for cleaning hands. For washing food, a separate sink must be provided. There should be a waste bin to discard used paper towels and tissue papers. Wash hands regularly and thoroughly by applying detergent. Rub palms together until soap is bubbly. Rub each palm over the back of the other hand. Rub between fingers on each hand. Rub backs of fingers. Rub around each of the thumbs. Rub both palms with fingertips. Food handlers or food processing units should always wear clean clothes to work. They should not smoke, eat or chew gum while cooking or handling food. The food handlers, while handling food, should not touch their hair, nose, or mouth, and should not wear any jewelry or any accessories such as false nails. Hair of the personnel should be tied back and covered with a hat or cap. Ensure food is cooked to over 70 degrees Celsius. Always cook or process food in a clean environment. Always store cooked food in clean closed containers at suitable temperature. Cold foods should be stored at 5 degrees Celsius or below. Store food containers off the floor to prevent them from picking up dirt which could be transferred to the work surfaces. Use only fresh fruits and vegetables to prepare salads. While cutting vegetables, ensure that the knife and hand is hygienic. Restaurant owners must make sure that any staff who handle food are supervised and instructed or trained in food hygiene in a way that is appropriate for the work they do. Food contact surfaces of equipment and utensils such as crockery, cutlery, and tableware should be maintained in good state of repair and working condition. The food counters and the dining tables must be easy to clean. The leftovers and waste should be promptly removed. Always handle cooked foods or ready-to-eat foods with a spoon. The customer should be provided with a bill containing the details of the restaurant, such as its name and date. At the cash counter of every food business center, the toll-free number of the Food Safety Commissioner and the Regional Food Safety Officer should be displayed to the public. The photocopy of the food business center's license should be displayed to the public. Food businesses have become widespread in recent times in response to the changing lifestyle and food consumption of people. Restaurants offer convenience and ease of access to food to busy individuals who are unable to prepare their own meals regularly at home. A rising tendency to eat out in different types of catering establishments has been observed for many years. Only full understanding of hygiene rules can guarantee proper quality of catering service and safety of the produced meals.
One can actively contribute to the success of delivering safer food and prevent foodborne diseases by adopting this practice.
Please contact Cohart for further details. Email us at cohart@kvasu.ac.in. Or you could also visit our webpage www.cohart.ac.in.